Welcome back to Daytime, everyone. If you're interested in looking and feeling younger, we've got just the person for you. Joining us is Dr. Matta, who runs a number of cosmetic clinics in the area. Thanks for being here.
Thank you for having me.
Pleasure to have you here today. Everyone was so excited that you're here because, you know, everyone has so many questions about cosmetic procedures. So I'm wondering, I know you have a lot of clients from throughout the Peel region. So what would be some of the procedures that seem to be the most popular at your clinics?
Probably the most common procedure would be Botox, specifically for the wrinkles and folds on the face. The number 11 that most people know when they scowl or they think too much or they're driving in the car and it's a sunny day. Non-surgical cheek lifts, filling with Restylane Perlane is a common one. Laser hair removal is very common, both for men and women. And even a full skincare routine, so people don't know how to take care of their skin, and we offer that too.
So you do cheek lifts?
We do not, yes.
So how do you do that non-surgically?
Well, often when you look at a child and you see what's so cute in the child, it's because their cheek is high. Okay?
And that's why everyone goes, oh, you're so
such
cute
cheeks. That's exactly what's appealing. Yeah. And I often show a picture in my talk with my child who's 7 years old, and he's already got these big smile lines. That's because he's got so rich of a face that way. And the reason it's so nice is because he's got a high cheek. So what we do is we use the Restylane and Perlane, and we fill up the cheek to bring things back up.
Oh, okay, excellent. Now we have some great before and after shots to take a look at from your clinic that you were so kind of us to provide. Let's take a look at those if we could.
Where would they?
Okay, we're just getting them ready.
Okay.
I think some of them are for age spots, and this is Botox.
That's Botox.
So where would you do the Botox here?
So that's a case of what we call crow's feet, and that's from the strong muscle around the eye. So we Botox maybe 3 or 4 injections just outside the eye.
Oh my!
And that's an after.
Look at that difference.
Yeah, and it takes about 4 to 10 days to fully kick in.
And how long would that last?
That will last on average 3 to 4 months initially, and the more often you do it, the longer you'll get. So people that have been with me for 4 years now are coming in maybe once or twice a year, because they've got that long-term benefit.
So now if someone were to do that, what would the cost be? That would
For something like a crow's feet area, you're looking anywhere from $300 to $400.
Okay. And those results were really dramatic.
Oh yeah, Botox is one of the few things in cosmetic medicine that we can say is fairly reliable in giving the results you want.
Now with Botox, there's a lot of other procedures that are things that are helping with too, like migraines. I've heard that Botox can help with.
Yeah. I use Botox for migraines, neck pain, back pain, excessive sweating. In migraines, it's actually about 89% efficacious. So a lot of people come in with migraines that typically will start deep in the low part of the forehead, in behind the eye. And when we Botox that area, it relaxes the spasm of the muscles and it releases the headache. I mean, I've had patients who used to be on hundreds of Tylenol 3s a month, and with Botox, they're off medication completely.
Now, if someone is suffering from migraines, where would you do the injections?
It's going to depend on where the migraine originates. A lot of people will have, as I said, the migraine that starts around the eye, so we would limit the Botox to there. Sometimes people say, well, it'll occasionally come on the side of the head or from the back of the head, and we'll Botox those areas also.
Wow.
Great, and I think we have another photo that we can take a look at as well that will be coming up in just a moment. So you also do laser hair removal. That's something that's quite popular, isn't it? And here we have a before,
Okay.
A before of a gentleman.
This is not representative. Yes, this is not representative of the typical patient. This is a fairly dramatic
Right. Oh my goodness.
Case. So that's looking
That's
at
incredibly dramatic.
7 sessions with laser hair removal, and that person would be an ideal candidate because they have a very light skin and dark hair. So laser looks for color. So the better contrast between the skin and the hair, the better result.
So if you do have if your skin is of a darker pigment, you may not be the ideal candidate for this?
May not be the ideal candidate, but we do have a laser that does dark skin, black skin, brown skin.
Okay, good.
Even on my skin, we can do it.
Okay, great. Well, we'll talk more. We have lots to talk about. Okay. Coming up, we'll have more with Dr. Matta after the break. Welcome back to Daytime, everyone. If you're just joining us, we're talking to Dr. Matta about cosmetic procedures. Now, before the break, we saw that very dramatic before and after of laser hair removal, and you said it could take several sessions.
Yes, on average about 6 to 8 sessions because hair grows in different cycles.
And some of the most popular procedures for laser hair removal are?
For a woman, most common would be underarms and bikini. And for a man, either the back or sometimes the unibrow, just to separate the one
That's popular.
eyebrow. Yes.
And I understand that the cost is actually quite reasonable considering you're getting rid of that hair for good.
Yes, underarms we are fairly inexpensive at $49.75 a session.
Wow.
And bikinis about $99 a session.
Now, how many men are you seeing in for some of these procedures? Is it fairly popular with the
You'd
male
be amazed.
population?
A lot of men are coming in for Botox. This morning I did Botox. The hyperhidrosis, which is the sweating, is a lot of men. We do cheek lifts on men, so men are coming in for a lot more than you would originally think. And down at my first Canadian location, I'd say about 80% of my clientele is men.
Really?
Yeah.
And what about Restylane? That's something that we're hearing a lot more of. So what is that exactly?
It's a filler. It uses hyaluronic acid. It's replaced the old collagen that you probably remember, because collagen used to cause allergic reactions, whereas Restylane Perlane does not cause allergic reactions. So it fills things in. So when things sag as we mature, we like to plump that back up.
So that fills in all the lines around your face from smiling and whatnot. So how long would Restylane last?
On average, 7 to 10 months.
7 to 10 months.
Yeah.
Okay.
And it has a cumulative effect. The more you use, the longer it lasts.
Now, tell us a bit about accent radio frequency treatment. That's something that a lot of people don't maybe know about.
It was actually just released in Canada in February of this year, and it uses radio frequency, which is a relatively painless procedure to reduce fat, whether it's around the belly, the hips, saddlebags. So it's a non-surgical option to liposuction, and you can achieve 1 to 2 inch reduction per session.
So where does that fat go when you zap it with the radio?
It's actually broken down and released in the lymphatics, and then you basically eliminate it when you go to the bathroom.
Oh, okay.
Wow.
Yeah. So people know they need to go to the bathroom after procedures.
And you just get rid of your fat that way.
Get rid of your fat that way.
Sounds like a dream.
Yeah.
My goodness. Now, if anyone is considering cosmetic surgery, what tips or advice would you give them?
Well, for a surgical procedure, you'd need to consult a surgeon that you are familiar with, that you trust. For general non-surgical procedures, it's important to define your needs and your expectations and your wants. So often a patient will say, what do I need? And I say, well, you don't need anything. It's a matter of what do you want. So you need to decide what bothers you the most.
You never should, as a woman, you should never go to a man and go, what do I need, honey? You don't want to ask that. That's a bad question. But no, we have to have you back, Dr. Matta, because I know that in cosmetic procedures, they're always changing, aren't they?
Yes, they are. We'll be glad to show you a demonstration next time if you'd like.
We'll have to do a Botox demonstration. We actually had someone working here that really actually requested that. So we'll have to do that next time. Coming up next, the hottest trends that will keep you warm this winter. What's keeping you warm?